Okay, return of sensation. Well, I had a little bit of return of sensation on the left side. I'm still pretty well wooden-handed and wooden feet, but I'm not up to my 6 months yet. I might get 4 toes back 6 months out. So I'm waiting for that. My sister, she got it all back the next day. She'd had MS 5 years longer. Lots of us figured out a long time ago. Life's not fair. Why would you think that? We're past that, right? We know better. But reduced pain. Well, my pain still comes back if I break off my gluten-free diet. I figured out a year ago, after many years off wheat, if I stay gluten-free, my neuropathic pain stays away. So just as the panel people have suggested, you should know too, this is an important piece of the puzzle. We should have this treatment as soon as possible for the circulation reasons and the recovery. It's a really big piece of the puzzle. Maybe it's 50%, maybe it's 80%. But you may need to do some other things too. Improved intimacy. I try to do that politically correct. I enjoy making love much more than I did, and there's quite a few of us have. If you improve the blood flow and get your feet warmer and your hands warmer, well, you can talk about that in public. But if you get better blood flow to the genital region, you're probably more likely to have improved intimacy, men or women. There are no guarantees, but it's a bonus, and a number of people have experienced it. And reduced anxiety or depression. I would suggest to you, CCSVI is much bigger than MS. It's probably the biggest thing that we've figured out that might make a difference in mental illness. I've lost 3 friends from suicide from MS already. I don't think there's any reason to lose them anymore, because we've got something dramatically reduces people's anxiety. And this is, I know it's a placebo effect, but you know, there's a lot of young people that go back to their workplace and their workmates can't believe what they're like. They no longer get uptight, anxious, fly off the handle the way they once did. I used to have a temper fuse this long. Nasty. It's way better. There's no question. It's not just to reduce fatigue, and I think we'll get the mood stabilization as well. We know that a lot of our anti-anxiety drugs are addicting and don't work that well, the same with the antidepressant group. And of course, why not mention it? Some of us are going to have to get off the drugs to get completely better too. Once you've had the treatment and the circulation's occurring, you're going to have to taper off very slowly, because the drug can be part of your problem. Whether it's numbness, balance, recovery issues, and so on, they've got some nasty side effects, especially when you're on them long term. Sometimes the pain drugs, the roughest one for us has been clonazepam, the anti-muscle spasm drug, which is a close cousin to Valley. And it's used a huge amount. It was a brilliant marketing move when they brought it out. They brought it out as an anti-epileptic muscle spasm drug. And there's way too many docs don't realize it. It's just Valium and another clothing. And it's hugely addicting. And you're going to have to get off it really slowly. 5% per week tops. And they don't make the drugs in that shape or form. You've got to spend a little money and go to a compounding pharmacist. But it's just part of the journey of rehabilitation, is changing the drug profile that you're on. Because things are going to change, folks. And most of them are going to change for the better, but they're not going to quit cold turkey. You can't do that. Your body is used to some of those agents, and you've got to take it off slowly, or you'll go through hell on wheels.
Is lorazepam also on the same family?
Yes, it is. Lorazepam is in the same one. And many of us have been on them for sleep disturbances. But the sleep disturbances are better. But all the problems, we know how they work now. Lorazepam and that whole family of drug works as far as sleep goes. You don't actually sleep any better. You just forget when you woke up. And that's the honest truth. That's how they work now. Done a lot of work on sleep, and read a couple of really good books when I was taking my integrated medicine training. It's uncanny, but it's true. Okay. Restenosis. Okay, that's everybody's fear. What if I get stuck and it gets small again? Sandra already alluded to it. She is being a good kid now. She's looking after her anti-inflammatory diet much, much better. But if you listen to what I said earlier too, the people treated early. The balloons were up for a long time, and they were put up several times. So we were sitting ducks, and they did more places up and down. Some people had 3 blockages per vein, sometimes 5. You don't blow a balloon up inside a vessel and leave it up for any period of time and stretch that vessel without messing up its blood supply slightly. Anytime you take away a blood supply, I mean, just put a tourniquet around your finger for a day and see it doesn't go through a lot of changes, okay? Well, it might fall off if you're really unlucky, but don't leave it on that long, just because I said so. But, you know, it really makes a difference, and that's why restenosis is an issue. Now, Dr. Mita reported on 150 patients. We're going to get to it later, but I'm going to mention it here, because Dr. Kirsty Duncan mentioned in her overview today. 9% of those people that had angioplasty to treat, at 4 months, only 9% had restenosed. So that's when balloons were up for a long time, and nobody was talking an anti-inflammatory diet and fish oil, however it makes you taste, okay, and those other features that we talk about. So it makes a difference. Some of us will have restenosed and will have to go back. Some of us will have to go back and get a stint in the azygous vein and occasionally in the hemiazygous vein. Most of us will not need a stint in the jugulars. Some of you are probably wondering, well, why couldn't I just have my vein replaced? Surgery on veins works terribly. They almost all block off, okay? So don't think of the ones that we do in the heart, because there you're putting blood pressure through it, treating it now like an artery, okay? So it's not the same thing. Sadly, almost all those block off within a year or two. So it's not the ones to watch. When Dr. Hewitt and others talk about restenosis, it's not when it'll happen, it'll just happen, but it's going to happen. They're usually referring to kidney patients, kidney dialysis patients who have their veins treated in most places in the U.S., but not here yet, 4 times a year, that they're taking clots out of their venous access, arterial venous fistulas in their wrists, all right? They block over, and they block over often. We have healthier veins than they do, and we don't have the high pressure of the artery pushing the blood flow through, and we will have less likelihood to having it. But it's expensive, especially now. I mean, we could do this pretty inexpensively, and I'd be a lot bigger fan of it than $25,000 to $48,000 per year on the drug. But, you know, you might as well do your best service to yourself. Spend a few pennies on anti-inflammatory diet and approaches and supplements a month before, 3 to 6 months after, and give yourself your best healing option. It works in all other wounds. Why wouldn't it work inside your veins? Okay, I think I talked also about shorter balloon times. Treat only the key sites. So that's usually the valves. In most of us, not all of us, but most of us, the larger balloons have permitted better treatment of the valves. And I've already talked about the diet and supplements. Go ahead. Optimal follow-up and flow. The first day we spent together, there was about 50 of us in a room. I thought it was going to be a shambles. 50 scientists and physicians trying to agree on a protocol by the end of the day. But we had a couple of superb people running it. Dr. Zamboni had found a brilliant fellow. He's a scientist and physician from Britain, and he had already done one on other venous issues where they got a consensus document, and by the end of the day we hammered it out. Optimal follow-up with ultrasound and echo color Doppler in the correct hands, meaning they know how to run it. 1 day, 1 month, 3 months, 6 months, and 9 months. That's a lot. It's nearly impossible here in Canada, as most of you know. And things are changing. Look at the picture. Wonderful picture, right? Blue. That's a vein. And what they do when they program these color Dopplers, if the blood is going one particular direction, that is toward the heart, it makes it blue. If the blood's going the wrong way, it inadvertently comes out red because the machine thinks it's an artery because it's going away from the heart. So that individual there with the color Doppler has got some reflux or reverse flow. You don't want reverse flow. It means things aren't opened correctly, right? So that's an indication that something has occurred or something needs treatment. So we're not at that stage yet. It's pretty tricky to get an echo color Doppler in Canada for a Canadian. It's not bad if you live near Barrie, Ontario. Sandy McDonald has a clinic and he's got 4 technicians trained and he'll put them through at $250 each. We're not quite that fortunate here, and it's a little trickier to get into the one, and you got to go over to Vancouver, and everything's got to be going in the right direction for everybody to be happy about looking after you.